Uh, Last week we had the opportunity to come before the public and speak to the requirement for employees, interns, contractors, grantees, et cetera, of the District of Columbia to be vaccinated. Today we are announcing the vaccination requirement for district healthcare workers. So by September 30th of this year, all healthcare workers in the District of Columbia must receive at least one dose of a 2-dose vaccine or the Johnson & Johnson COVID-19 vaccine. This requirement applies to all licensed, certified, and registered health professionals. There's over 70 here in the District of Columbia. All emergency medical services providers, such as paramedics and emergency medical technicians. In addition to DC Fire EMS, there are approximately 12 private ambulance services in the district, and so this helps capture that population who are often the first people that some of our residents encounter when they need to receive emergency or urgent care. And all unlicensed health workers in the district. So we all know that there are many individuals who work to support our healthcare system who are not licensed. These are folks who help to keep our hospitals and healthcare facilities clean, to make sure that patients have food to eat and dietary services, and even some of the aides that assist people in their homes, such as personal care aides, do not require licensure. So it's a very robust requirement, and it is necessary for us to ensure that we're creating safe environments in our healthcare facilities and in our any places where people receive healthcare to help disrupt the spread of COVID-19 and to make sure that we can prevent outbreaks in these environments. So in terms of when the second dose is due, anyone who's going to be submitting an application for licensure, certification, or registration in DC should have proof of 2 doses of the vaccine. Any renewals for those applications should also provide proof of a vaccine. And as I mentioned before, the requirement for the first dose or the Johnson & Johnson vaccine is September 30th. And we'll continue to make sure that all of our health professionals and healthcare workers have the most up-to-date information regarding this requirement.